Our guest speaker is a surgical oncologist, a personality development and wellness coach. He finished his medical education at De La Salle University, finished his master in business administration degree in Ateneo. He is also an on-demand international speaker, been to different countries. Just like right now, he's doing a lot of Zoom meetings. So please welcome my trusted best friend and our eldest brother, Dr. Roel Tolentino.
Thank you to my favorite sister, kasi siya lang ang sister ko. Anyway, magandang araw, magandang gabi, magandang hapon sa inyong lahat, sa anumang parte ng mundo. Number 4. Masarap ba to? Buto-buto. Okay, number 4. Yung bone marrow natin, ito yan, mga buto-buto. Yung bone marrow natin, yung mga gitna, ito. This is our long bone, yung gitna. We call this bone marrow. And this is where some of the cells are produced to fight bacteria, viruses. Yan. Okay. Inside the bone marrow, no, or in our blood system, we have platelets, red blood cells. Ang platelets is more for the coagulation. Ano po ba yon? Pag nasugatan ka, hindi nagdudugo ng matagal. Dahil yung platelets, sila po ang nagbabara sa mga blood vessels to stop the bleeding. We have red blood cells for oxygenation. We need oxygen to sustain the life of our tissues, our cells, and we have the white blood cells. White blood cells coming from the bone marrow. We have different kinds of cells, basophils. Anyway, sabihin ko lang po isa-isa, no? Hindi ko kailangan yung i-memorize. Basophil, neutrophil, eosinophil, lymphocytes, monocytes. Okay. Very important are the neutrophils. These are the fighters. Sila po yung nag-a-attack sa ating mga foreign invaders. Eosinophil is very good for parasites, mga bulate, no? And for the white blood cell types, we have, as I have said, neutrophil, eosinophil, basophil, lymphocytes very good for the viruses. Neutrophil for the bacteria, white blood cells. Okay. Let us say you have a cancer cell. Lahat po tayo may cancer cells sa katawan natin. Huwag niyo sabihin wala kayong cancer. Theoretically, you have cancer cells, but the good thing is our immune system is fighting these cancer cells. Okay. Example, we have a natural killer cell. Okay, yung natural killer cell natin is one example of a white blood cell. They attack this cancer cell, and what will happen? Because of our powerful immune system, there will be deaths of these cancer cells or bacteria or viruses. Yeah. They fight our invaders. And also inside our body, our immune cells, there is what we call phagocytosis. So some white blood cells, sometimes they attack. Other white blood cells, they do phagocytosis. Ano po ba yung phagocytosis? Parang Pac-Man yan. If there's a bacteria, kinakain nila, pagkakain nila, they will destroy the bacteria or the virus inside the white blood cell. Yan, si Pac-Man. Number 5. Yan, lymph nodes. Ito yung tinatawag na salaan ng ating katawan. Now, probably you've noticed if you have an infection you will have an enlarged lymph node. Example, infection in the fingers, you will have axillary lymph node enlargement. You have infection in the toes, you will have lymph node enlargement in the inguinal region. So, tandaan nyo po, ang lymph nodes, tagasala ng ating mga dumi sa ating different parts of the body. So, these are the many different lymph node basins inside the body. Marami po yan. Punong-puno po tayo ng lymph nodes. And yun po ating mga bituka, especially small intestine, there are lymph nodes lining the small intestine, pati colon, but more of the small intestine. Kaya kahit po maraming bakterya dyan, hindi yan makakapasok dahil pinapatay na ho ng mga kulani sa loob. Okay, what will happen? You have an artery bringing the blood in the lymph nodes. Ang gagawin po ng lymph nodes, sasalain niya para paglabas sa vein going to the heart, malinis na po yung inyong dugo, free of bacteria, viruses. Swollen lymph nodes may be due to bacteria, may be due to cancer. Kasi, example, breast cancer. If you have a breast cancer, some of the cancer cells will go out outside the body. They will go to the lymphatic channels. They will go to the blood. And these cancer cells will be trapped in the lymph nodes in the axillary region. This is the reason why when you have breast cancer, you have swollen lymph nodes in the axillary region. Common causes of swollen lymph nodes. Ano? Huwag po kayong mag-alala dahil ang lymph node enlargement is part of fighting diseases in our body para hindi na po kumalat. Yung lymph nodes, they do their part. Common causes, infection, common cold, or meron kang sirang ngipin. Bakit meron kang lymph nodes na malaki sa ilalim ng mandible mo dito? Meron. Because you have cavities, flu, streptococcal bacteria infection of the throat, HIV, and many other form of infection. Tonsillitis. When you have tonsillitis, meron dyan lymph organ, so lumalaki po yung tonsil. Number 6, very important, again, I always emphasize vaccination against common diseases. No? So, alam naman natin to, vaccine is being injected in our body to promote immunity against a certain type of infection. So, pag na-inject ka ng vaccine, what will happen? Yung katawan mo, magkakaroon ng konting makikita nila. Actually, yung vaccine being given, they are attenuated, meaning non-harmful viruses or parts of the viruses. So, pag nag-invade yan, yung katawan natin, sisirain sila and nagkakaroon din nila tinatawag na recall. So, the next time we will be infected, yung mga katawan natin, we have an immune system na, kilala ko tong invader na to ah. So, di ba, alam na natin kung anong gagawin natin, di ba? Last time we were invaded by this and now we know how to react on these antigens.